Hello, Central School District families. First, we want to thank you all so much for your continued partnership, for keeping your students home when sick, and for letting your buildings know if you have a positive case of COVID at home or you have been a close contact of a positive case. Thank you all for encouraging proper wearing of masks and for your grace and patience as we work through the start of the new school year in person. I want to take a minute to provide some clarity about both the rapid testing program at school as well as isolation and quarantine procedures. I also want to let you know about how we have streamlined communication around COVID-19 cases and close contacts in schools. When a student shows symptoms of COVID-19 while at school, we have the tools available to conduct a rapid test. This test is not as precise as the PCR test, but it is effective at quickly identifying the presence of the virus and therefore reducing the spread of the disease. If the school has parental or guardian consent, a student showing symptoms at school will be tested for COVID-19. If the test is negative, your student will need to be picked up and taken home until symptoms improve and there is no fever for a 24-hour period without the use of fever-reducing medication. If the test is positive, your student will need to be picked up and taken home to isolate for at least 10 days and until they have improving symptoms and no fever for at least 24 hours without the use of fever-reducing medication. Please know Polk County Health Department will also follow up with you with a phone call. If the school does not have parental or guardian consent, the student showing symptoms may not be tested at school. Your student will need to be picked up and taken home. In all cases, we recommend that parents follow up with their primary care physician. You may have heard the terms isolation and quarantine. There are differences. Isolation is when a student has tested positive for COVID-19. If your student tests positive for COVID-19, they will need to isolate from others for at least 10 days and until symptoms are improving and they have had no fever for 24 hours without use of fever-reducing medicine. Quarantine is when a student has a close contact with someone who has tested positive for COVID-19, and there are 3 types of quarantine options. When we talk about day 8, day 11, or day 15, we are talking about the number of days from the day the person, the close contact, was exposed, you will receive an exposure date, to the positive COVID-19 case. It is recommended for students and staff 14 days quarantine with return on day 15 with no signs or symptoms. This is the safest option because the COVID-19 virus can take up to 14 days before symptoms start. At a minimum, students and staff would be quarantined for 10 days with a return date on day 11 if they have no signs or symptoms of COVID-19. Please continue to monitor yourself for symptoms for the full 14 days. At day 5 after exposure date, students or staff may take an antigen or PCR COVID-19 test. If that test comes back negative, they may return to school on day 8 with verification of the negative test. Again, there should be no signs or symptoms of COVID-19. Please continue to monitor yourself for symptoms for the full 14 days. If the student or staff who has been exposed to COVID-19 is fully vaccinated, again, that's you've received 2 doses of a 2-dose series or 1 dose of a single-dose vaccine, and it has been 14 days since your final dose of that vaccine, no quarantine is needed. They do, however, need to watch themselves for signs and symptoms for the full 14 days. The CDC recommends that even if vaccinated, an exposed person take a COVID-19 test between days 3 and 5. Finally, we have launched a district COVID response team who will be reaching out to families with a positive case or a close contact. Centralizing communication around COVID will provide clear and consistent communication to our families and community, as well as allow our staff to move quickly back to the work of educating students. Thank you for continuing to help keep our schools open to in-person learning by wearing masks, washing your hands, maintaining physical distance where possible, and keeping your student home when they are sick. We know this is hard, but while the virus is here, we know this is what we will have to live with in the schools for a while longer. For more information about anything I've just discussed, testing, isolation, quarantine, vaccination, or the new district COVID response team, please email me at info@central.k12.or.us or call 503-606-2251, and we will work to get you an answer. Again, the signs and symptoms of COVID-19 include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Continue to stay healthy and safe as we are Central Strong.